everyone, I am here again, and tonight it's around 10 o'clock in the evening here, and I just, I felt like I needed to discuss this with you. Um, our topic for tonight is about our pelvis, what's inside our pelvis, and why we need to know about them, especially we are going to talk about hormones in my future videos. We're going to talk about it, and also some other issues that usually women would feel or have, or being diagnosed with. And I feel like not knowing our own anatomy is just one problem that we're all facing. So when we go to the doctor, when they're saying something about what's happening inside of us, especially in our pelvis, we don't really understand what they're talking about. So then that's the time we Google. So at least with this video, I'm just going to give you an overview about our pelvis and what's inside it. Okay, so to start with, I have here a, our pelvis. Okay, so this is what we call the pelvic bowl. It does look like a bowl, and inside our bowl, we have here our bladder, our uterus, and our bowel. So see how it is related? They are so closely related to each other. Later, I am going to pull out the parts, and so we can know that these three organs are very much in close relationship with each other. That's why sometimes if we are having our menstrual period, it's either we feel constipated or we are having some diarrhea, or sometimes we have the urge to urinate, right? And under here, I'm going to show you. So this is our external part of our pelvic floor muscles, and this is what we call the vulva. A lot of times we refer this as vagina, but actually the external part is called vulva, and the inside is what we call the vagina canal, and that is where the babies, would pass through during birth. Um, I'm going to pull out the uterus. Okay, so this is our uterus here. Sometimes things fall over here. A lot of I try to keep them together as much as I can. All right, and just an overview before I show you the uterus. So this is our entirely, this is our spine right here, and this is our pelvic bowl. So see, it does look like a bowl, and we have some muscles here we call the pelvic floor muscles that's supporting our pelvic organ. So it is also important for us to strengthen our pelvic floor muscles because they will keep our organs together or in place. And so if we have a strong pelvic floor muscles, we are preventing some prolapse. I'm sure you've heard about pelvic organ prolapse. And tonight we're not going to discuss any of those. All right, so here is our uterus. So as I have mentioned before, the external part is actually what we call the vulva, and the opening here, this is our vagina. This is our vaginal canal. So it's quite long, and then this is our uterus here. And I'm gonna flip it. This is so the yellow dot there, both these are our ovaries, right? These are our ovaries, and these are our fallopian tubes, and this the finger like part here is what we call the fimbriae. So this is very important, especially they're closely related with our ovaries. So when we release eggs, when we have ovulation, this finger-like movement would help what do you call this, would help the eggs travel through the fallopian tube, so the eggs will go into our endometrium. And if there's any pregnancy that's occurring, this is where the embryo would be attached. So this is the inside of our uterus. So here is what we call the endometrium, or the endometrial lining, which is highly discussed when we touch on the menstrual period. But for now, we're just going into the parts of our uterus, okay? And then here is I have also mentioned already early on that this is the vagina canal. So when we say about the vagina, it refers actually to the canal, to the muscles here. Here, if you can see, this is our cervix here. This little opening here, this is our cervix. So for the people, or for ladies that are using tampons, especially teenagers, this is where inserting it in our vagina canal. And for whatever reason, sometimes it gets stuck there, or if you have some fear that it's gonna go into your entire system, you don't have to worry about that, because it's really just gonna stay there. It's not gonna go anywhere. The cervix here, it serves as like a gate, so it is very protective. And any foreign bodies, whenever it senses that there is a foreign body there, it'll just close up. It's not gonna go through. Okay, our vagina, our vagina canal is really long, so it's enough to support the tampon when during our menstrual period, to support the menstrual period. So it's not gonna go into deeper into the uterus. Okay, so but for some reason, if the tampon is being stuck there because maybe the string is, I don't know, for some reason not there, that would prompt us to go to the emergency. And it is very important because it can cause toxicity in our body, and it's not good. It can cause also infection. All right, so again, this is our vagina canal, vagina opening, and this is here our uterus. And towards down here is our cervix, right here. And this is the endometrial lining. And this is our ovaries here, the yellow. And then this is the fimbriae. And then this is our fallopian tube. Okay. So there you go. This is our female reproductive organ. And it is very important for us to know the parts, especially the endometrial lining, when we talk about menstrual health, because it is very important. And then if you can see, I just removed the uterus, so you can see the bladder where it sits, and also the a bowel. At one time, my patient was asking me, like, "Where is our bladder? Is it on the side? Because I can feel it when I'm about to do number two or move my bowel. I can feel pain there." And I'm like, "No, not really. It's towards our spine, but maybe she is just feeling like radiating pain. So maybe the bowel is full, and then she is just feeling it on the muscles here." And I'm gonna remove this part here, this layer, so you can see the relationship between these three organs, how closely related they are. So again, this is our bowel here. This is our external sphincter, external anal sphincter. And this is our uterus. It leans back kind of to our bowel. And this is our bladder. All right. Oops. Let me just push them in because there. All right. So look at that. See how closely related they are. So this is our bladder, our uterus, and our bowel. So sometimes um, if we have when during our menstrual period, we feel like, there's pressure in our bladder, so that's why we have the urge to pee. Or sometimes the bowel, because they are very closely related. When we have our menstrual period, it is inflamed in some parts here, and what is directly affected is our bowel. So we're going to discuss that in my next future videos. And it is also important for us to know the position of our uterus, because some uterus are just tilted back or tipped back. They're leaning so hard on the bowel. So whenever we have our menstrual period, it can cause low back pain because it's pushing. It's pushing in our bowel, and then this is the spine here. So it can also cause back pain. And there is also reason why we need to know the uh, position of our uterus, because when we have our menstrual cycle, this can give us like a peace feeling why we have some brown spottings. Okay, so for now I'm not going to discuss about it. I just want to discuss about the relationship between these three organs. And just remember that this part here is what we call the vulva. This is the vagina opening, and this is our bladder, the pee hole. Are you? Mm-hmm. And this is the yellow, is the clitoris. It appears really like a tiny muscle here, but it does not. So we are going to tackle that as well because it plays a very important role as a woman, um, for for stimulation and orgasm. But for now, we're not gonna talk about it. I just want us to be familiarized of our own reproductive organ and its relationship with the muscles that's it's sitting on, the pelvic floor muscles. Okay, so that's about it for this video. And see, these are our pelvic floor muscles, and we need to know them as well. And so we can strengthen them. So we are going to prevent having a pelvic organ prolapse. Um, Thank you so much. And we have a Facebook group. The name is also, our group page is called Let's Talk Women's Health. And I hope you are going to subscribe and join our group. And we also have our page. It's the same name, Let's Talk Women's Health. So in that way, every social media is linked to each other and related, so it's not hard for you to find. Okay, thank you so much. Thanks for watching, and I hope to see you in our group page. Thanks. Bye.